Is the CEO of WeRPN, which represents many of Ontario's nurses, the Registered Practical Nurses Association in Ontario. They've got a new study that no doubt is concerning. So we'll talk about some of those concerns. And Dianne joins us now. It's great to have you on.
Thanks, Greg. It's great to be here.
I lay all that out there, and yeah, we've got concerning times. Do you worry that not just the government, provincial government, Dianne, takes their eye off the ball when it comes to health care, but the people that are there and maybe paid to hold the government to account take their eye off the ball enough? I talk about it as much as I can, but it still doesn't seem like it's enough.
Yeah, and Greg, you did a great job of sort of summarizing, but the piece that was missing was that with our aging population, there is a growing need that will continue over the next year to put additional pressure on the system. So we've got an added reason to act really quickly.
Yeah, we do. And what I think is lost, this should be, again, we got flooded roads and this and that, but the lead story, my lead story today would be, guess what? No matter what the provincial government's saying, we're losing more registered practical nurses than we're gaining. That's not the message we're getting from the provincial government, but you have the data to bear that out.
Yeah, I mean, that's one of the things that is over and above what nurses told us in our survey that is most upsetting to me is when we look at the nursing numbers. Yes, we're graduating a fair number of practical nurses into the system, but we are now 466 less than we were this time last year. So while all that work's going in, until we solve the fact that our survey showed 48% are considering leaving, until we solve the reasons that they're considering leaving, then we're going to continue to see the numbers of practical nurses drop at the very time we need tens of thousands more to meet the needs, particularly for the future.
Where do the nurses go? Do they leave the healthcare industry, or do they go to another province or the States?
So they're not required to report where they're going when they leave their jobs in Ontario. The numbers I'm talking about have given up their nursing registration, so they're not nursing in Ontario anymore. We know that. But lots of nurses, I think, stay in the province and leave the profession. That seems to be the decision for a lot of them. Some of them move on to new positions. Some of them move away from direct patient care. But we have no way of knowing exactly where they go. We just know the numbers of them that exist in the province are fewer.
Dianne Martin's joining us, Chief Executive Officer of WeRPN, the Registered Practical Nurses Association in Ontario. I see that wages and workloads are the two leading factors contributing to the decision. Big numbers there. 84% say it's wages, 77% will say workloads. It doesn't have to be one. People could pick multiple choices, obviously. Do you see one as more significant than the other?
Oh, that's a really good question. I would say yes, I do now, because some areas of nursing have started to sort out through arbitration, have started to sort out the wages. Hospitals, for example, are starting to look better in terms of wages. So I would say in areas like those, it will be workload. There are some areas like home care that has not started to improve that in many employers. But the workload, we had a nurse tell us that every day, because she has to pick and choose what care she's providing, because of the sheer numbers of patients she's taking care of, we had her tell us that every day she leaves feeling like a failure. And that also explains the mental health issues that nurses are experiencing. If you could imagine leaving your job every day feeling like I did a terrible job today, and the meaning behind your job is caring for people, saving lives, etc. It's a very, very difficult burden that we're putting on.
Well, and that's why not to dispute that wages wouldn't be an issue, but if I felt like that, the way you just described it, I bet our listeners hearing you say that, it resonates with them. You couldn't pay me enough to continue. So I almost think the working conditions kind of trump like making a buck or two more an hour, having a little more in your pocket every 2 weeks with a paycheck. If the job was, and I believe it is, this stressful, this demoralizing, most people will say there's no amount of money that can make me continue. So you must hear that as well.
Absolutely. Without fixing workload, you're right that wages can't can't improve things. 91% of nurses told us that they have seen impact on patient care. That for a nurse is a very, very tough thing to witness. So, you know, and one of the other issues, Greg, is that it's been sort of normalized. You know, when I was a young nurse, I would go into work and, you know, there'd be the day we were short-staffed and we'd talk about it for a full year afterwards. Remember that day?
Yeah.
And now nurses go in and not only are they short-staffed, but nobody's showing up to say, hey, guys, you can do this. This is an odd occurrence. It's completely normalized in many areas. And so one of the things that we've got a list of things that we're recommending, but one of the things is that nursing leadership or hospital leadership, long-term care leadership, show up to nurses every day and say, how can I help? You know, how can I make this better? Because normalizing it is only going to hasten the feeling from nurses that this is not the profession for me.
I yell and scream a lot about this, and I look at some of the systems that are working in Europe, and whether it's Germany, even the Far East, whether it's Japan, whether it's all the Scandinavian countries, and they've found a way, not with our system, but they found a way to have a balance of having some private money go into the system. Are nurses open to this concept? I hear you loud and clear. We don't want American-style health care. I live there. It doesn't cover enough people at the baseline. But are you open? Are nurses open to at least having conversations about fixing our system as opposed to just pouring more money into the system? Maybe both are important.
Well, now, Greg, you've hit my favorite topic, because privatized healthcare, if it's done a certain way, is very expensive. When you talk GDP spent on healthcare, it can be very expensive. But if you find ways, Australia, for example, has a solid, they're having a nursing shortage, but they have a solid combination system. And I don't know how it works because I don't know enough about the system, although I visited there a number of times. But the temptation is to go and look at what's closest, which is the American system, and that would be really the nail in the coffin for the community.
No, that wouldn't work. I left your favorite topic way too late. So let's give more time and only focus on the favorite topic next time we talk. But I'm glad you brought these numbers to us today.
Yeah.
Thanks, Dianne.
Okay, thanks so much.
You got it. Dianne Martin, CEO of WeRPN.